Let's just get Dr. Muntasir Abdelaziz. He's a consultant respiratory medicine in Tameside Hospital in the UK, and he is going to one of these initiatives he is proposing, and we are supporting of it. Dr. Muntasir, are you there? Can you talk to us about the initiative?
Yes,
yes, Doctor. Yes, very nice to see you.
Okay, I'm trying to share something with you.
Yes, let me give you the.
I don't know whether I'll be able to share it or not. Just let me.
Yeah,
see.
I will give you. What is it? I will give you.
Share it now.
Excellent. Yes. Yes, maximize the slide, Doctor.
Yeah. Huh?
كليك on the bottom بتاع الشو بتاع السلايد. Yes.
Yes. Okay.
تفضل يا دكتور.
I remember one day I was listening to Radio 4, and I think a representative from the WHO mentioned. He made a comment. He said, history will be written. And I don't want history to remember us as the people when we had this problem. We started by vaccinating the developed countries, the rich countries, and then the developing countries left late, and they get what left over. And I think we have a moral dilemma here. I think the world have a moral dilemma regarding the vaccination. And I think there was an article in the BMJ saying that the developing countries might get the vaccine in 2002 or 2003, and in some article, 2004. So I thought probably we should start an initiative here as doctors we are originally I'm from a developed countries. I'm from Sudan, but I'm living in a developed country now, and I've got the luxury of having the vaccine early, being in the front line. But I think I think if we work hard, all of us, to try to establish some sort of vaccination in the developing countries. I'm not saying Sudan only, but I felt probably to start vaccination in all developing countries too much. It is beyond my capability and beyond the capability of our groups. So at least we start with Sudan, and then we can even later on help other countries. And I guess I collected this data from one of the articles in the BMJ, and they said that the rich countries, the population of the rich countries about 14%. However, these rich countries got 53% of the vaccines. So in the mentioned example, all of the Moderna vaccine being taken by the rich countries, 96 of the Pfizer vaccine, and in actually it has been alleged some of the countries, the rich countries, have ordered 3 or 5 doses per person. And if we come to Pfizer, to AstraZeneca vaccine, they actually they promise that about 64% of their vaccine goes to developing countries, but even that will cover only 18%. So it is a real problem regarding people in the developing countries to get vaccines. And here we are one world, one village. We should not just, oh, I'm safe, forget about them. I think we should all think of the whole world as one village, and we try to help everywhere. Actually, the developing countries remain helpless. For example, they mentioned in that article about 67 low-income countries. They made no effort to purchase or to buy any of the vaccine, and they are just waiting for the leftover doses. And actually, they rely on what we call COVAX program, and this is a program where the WHO, UNICEF, and Bill Gates, many foundations actually working together, and they are trying to secure about 700 million doses, but that will immunize only 10% of the population in these countries. So there is a real problems. There is a real problem regarding vaccinations of developing countries. And the problem, I can just summarize it in the shortage of doses, because even some of the countries, they don't, even in UK now, they decided the Pfizer vaccine to give it after the second dose after 3 months, because there might be a problem with the doses. Also, India's Serum Institute, they felt they were providing a huge doses, but they will give the priority to India, which is understandable. And also, they mentioned that there is lack of funds, despite the heavy weight of this alliance. Still there's lack of funds. And of course, also the readiness of the country to establish a robust vaccination program. For example, if we provide out the vaccine to Sudan, I don't know, are they ready to, or other countries, forget about Sudan, any other developing countries, if they tell them, okay, we'll give you the vaccine, where are you going? Are you ready to vaccinate your people? So I thought probably one of the things which we can help in is just the fund, and also to help the countries to establish a vaccination program. Now, regarding the fund, I believe that any money, I don't want to give any money to countries. And I believe the money should be given, if we collect money, we collect money to a charity fund provided by the WHO or UNICEF, because I'm really sorry to say that, but my feeling actually, if we give money to developing countries, this money will not go to the right people, and it will not be used for the vaccination. So I think the whole idea is we have to establish a connection with the UNICEF, with the WHO. If they give it an account, we can raise the money. I met people say that I'm happy to vaccinate 100 person, 1,000 person. Himself, one person said, I'm happy to provide money to vaccinate 1,000 person. So if every person, for example, say vaccinate 10 persons, I'm sure we can vaccinate people in developing countries. And I believe that the people of the world have got a conscience, and the people of the world will help here. So the fund is the easiest to raise, but the fund has to go to a recognized. I don't want myself to be involved in any money business. I wanted the fund to go to a charity account provided either by the UNICEF or the WHO. The other thing, we can help in help the country which we are going to receive the fund, to help them regarding the logistic things, regarding how they give the vaccine. The vaccine, actually, I thought, which is suitable for Sudan or for developing countries, will be the Pfizer vaccine, because we don't need the temperature of -70 for the Pfizer vaccine or -30 for the other Moderna vaccine. The other vaccine which we can help, I think might be the Chinese one, which is a traditional way of doing vaccines. So I think this is ideas, and I've established a group, and I included some of the UK, one of the British people who are not related, but they did work in Sudan before, and did some humanitarian work in Sudan. And I guess I'm just giving you my ideas, and it is something, every help welcomed, and any ideas is welcomed. I think that's what I wanted to say. I have got nothing else to add. Yes, but any ideas, any help is welcomed.
Good initiative. Many people, I think, and I'm sure in the diaspora, many would have or will have something similar. What do you want us to do? We are all diaspora here, most of the people watching you. What actions do you want us to do? I mean, in terms of this initiative, do you want people to start thinking of donating money? Do you want people to start of thinking maybe giving up their hands for they have experience, and so on? Before I have question asking, Any question, any suggestions, Dr. Muntasir?
I think for that, it is very important to establish a program in Sudan, a robust program, vaccination program in Sudan, in the sense that because even if you provide the vaccine and you bring it there, are they ready to start this program? This one thing. The other thing is, which is, of course, collecting the money, I thought probably is the easiest part. And I'm just hoping that if I get this charity account, if anybody has got a connection with the UNICEF or with the WHO, and he can get me this charity account, we can start collecting this money very easily. Okay. Now, the other thing which is we have to work on is to providing the vaccine itself, because even if you have the money, we must not be able to find the vaccine. So we might, I think, I already I had made some connection with AstraZeneca. They haven't responded yet to me. I said, we don't want any help from you. We just wanted a provision of the vaccine. We pay for the vaccine and everything. Just we want the provision of the vaccine. They haven't responded to me. My feeling, actually, we might need also to try to get the Chinese vaccine, because the AstraZeneca might not be enough for the whole world. And I don't know how much we'll get from it. So I think that one of the things which is, I think I can summarize things. I wanted a charity account. I wanted some work with the Sudanese government regarding how they are going to organize, like liaising with them, how they are going to administer the vaccine, how they are going to transfer the vaccine to other parts in the Sudan, if they have to be ready to do that. And of course, we will try to make the connection here regarding providing the vaccine itself. We should be providing this. Our group should be helping doing this by communication, either with the vaccine provider. Okay. I'm happy, for example, if we can establish a link with the WHO or with the UNESCO, and we do it through them. I'm happy with that, because one of the things which they have a problem is the lack of fund. So if we provide them with the fund and they organize everything, I'm happy with that.
And we're going to connect, we have one of our very strong partner is UNICEF, yes, globally and in Sudan in particular. And I'm going to approach him, and I will, yes, definitely come back to you. And I think we're going to have a very concrete discussion on this initiative, but it's good we highlight it now. But yes, Dr. Muntasir, before you go, or before we move, we're going to open the question now. We have people, yes, waiting. But there's a question being asked twice last time, and we are just lucky we have you. Apart from your initiative, great initiative, and you want to help the poor countries, Sudan in particular, mm-hmm, but you are a consultant in respiratory medicine. If you don't mind me asking a question about this respiratory medicine, mm-hmm, there are people very angry from developing countries, particularly Arab countries. They say shisha, people smoke shisha all over the place. This is not just from one country. It came from Dubai people, Morocco, Tunisia, even Sudan, Egypt. They said that they are not even like living in a world of lockdown. You go to a shisha place, all of them are drinking shisha and so on and smoking. Plus the normal smoking. The question raised here in the UK last time, but we didn't have someone like you to answer it. Because of the lockdown, now people are in the house. Those who smoke, okay, particularly small places like, flats. The danger of the passive smoking, people say, is more serious now than before, because you have your kids and so on. And this disease or this virus actually attacks the lung. And you are a consultant of respiratory. So what is your message? We really want to take the advantage of you here. And you are, I think, quite senior, and you are very having a long standing in this area. Please, if you answer all of them, I'm sorry to take you out of the donation room, but this is quite an important question.
Yeah, I think the passive smoking, we seem, let us, first of all, no chest physician will advocate continuing smoking. Smoking is bad. The message is smoking is bad, whether it is passive or active. Okay. Now, I'm just going to say something here, and it is not scientific. Some people believe that smoking protects against COVID. Whether that is true or not, there is some claim that it protects against COVID. Like, for example, inflammatory bowel disease, they felt that people who smoke also, they have got some protection against inflammatory bowel disease. Nobody understands these things. But smoking is bad, whether it is passive or active. I myself, as a chest physician, have seen people with chronic obstructive airway disease, which is COPD. COPD, by default, is caused by smoking. And I've seen people with COPD who have never smoked, but they have been exposed to passive smoking from their parents or from the husband or the wife. So the message is, whether it is shisha or non-shisha, it is all should be forbidden. All the cancers, most of the cancer actually, if you take cancer of the tongue, cancer of the esophagus, cancer of the stomach, cancer of the lung, all linked to smoking. But in particular, cancer of the lung is highly linked with smoking. And cancer of the lung is one of the worst cancer you can ever have. If you want to have a cancer, if you ask you which cancer, the worst cancer you don't want to have, is the cancer of the lung. And the cancer of the lung, the treatment has improved a lot, and especially if it's caught early, but it's still, it's a killing disease. So this is my advice. Okay. And there's a claim, as I said, about smoking, and this is not true. Okay. It is not scientific. It is not scientific. I'm not advocating that, and don't believe in it. Okay.
And doctor, there is also a question being asked before. People understanding, the general public, not like you, the consultant, like me and those who are not medics, what we understand, this virus affects the lung and it goes into your respiratory system. Yeah. And those who they lose their life, high likely there is a damage happening in the lung. Those who survived this attack, whatever damage, small or whatever moderate is in their lung, is it reversible or irreversible? So whatever damage, now I'm free from the COVID, but I had the COVID. This question was asked, but I have seen no one answered before. So what is your answer?
I think most of the people, the changes are reversible in most of the people. There is few people, it might not be reversible, but this time will tell. Time will tell, because it's too early now to say that it is irreversible. But from our experience, most of the people, how bad the lung was affected on the chest X-ray or the CT scan, when you follow them later on, all the changes disappear. Okay. Now, I wanted to come with Professor Alam also to the smoking also. Some people also say passive smoking is actually worse than active smoking, because passive smoking, when you smoke through a cigarette, you've got the filter there. So many of the bad stuff goes through the filter. But those with the passive smoking, they have the smoke without a filter. The same thing, people with the shisha, you have got the water work like a filter for, it does not filter everything, but it filters a little bit. If you are sitting with people doing shisha, the smoke without a filter. So some people actually believe that passive smoking is worse than active smoking. So this is the answer about smoking again. Okay.
And doctor, just final question. Those who they had the COVID, and you said time will only tell whether the effect on their lung is reversible or irreversible. What is your advice for them now? Those who have, alhamdulillah, they recovered. Do you advise them to do any exercise, anything to help what happened in their chest?
Yes. First of all, I wanted to tell people also the recovery from COVID is very slow. Because even after you recover from it, you'll find that your exercise tolerance will not go back to normal very quickly. Some people might have cough, which might last for a long time. Okay. Having said that, the most important thing is, if the symptoms are not improving, you should ask for advice. you should be seen by a doctor, because sometimes there is one of the problem with the COVID. It can cause clotting in the lung, which is pulmonary embolism, and increase the coagulation, the coagulability of the blood. And I've seen it myself, actually. I've seen people after they recover from the COVID pneumonia, they continue to have shortness of breath. And then we saw them again in the clinic, and then we did for them a scan, a special scan, what we call a CTPA, which is CT angiogram, and they found that they've got a clot in the lung. So if the symptom is persisting, you should ask for medical advice. Other thing is you have to exercise gradually. You have to rehydrate yourself very well, and you have to eat healthy and eat well, and stay away from smoking. And don't believe on the fact that smoking protects against COVID, although they say that.
Okay. So those who recovered, alhamdulillah, the advice is to continue, to check with their GB and to see what else they have to do, because they have to start thinking of the long-term healing of this virus. Okay. Excellent. I think we have Dr. Isam Al-Zaddin asking question earlier. Isam, are you there? Can you hear us? Dr. Isam Al-Zaddin. Because people, I hope you can appreciate, it's quite difficult to respond. Dr. Isam Al-Zaddin, can you hear us? Okay, what I can do, thank you very much. I think so far you can appreciate we have to bring these people at different time, because some of them are working. Even Dr. Muntasir himself is on duty now. Hussam was on duty. We have Dr. Defa join us from his clinic in Al-Fashir. So I need to move now, and the question will continue. Thank you all of you very much so far. Dr. Ali Al-Bray, Dr. Muntasir.
Professor Alam, I want to thank you.
Not a problem at all.
You are doing great work and connecting all these people together and for a good cause. And I will be also, I think the meetings continue. I'll be following it up. And I'm happy for even if there's other questions later on.
Once you have free time, just alert me. You are back. Hussam is doing the same. He said he will take another time and he will alert me, and then we know you are there. Then we will bring you on again.
Thank you very much.
جزاك الله كل خير يا دكتور. شكرا. Thank you very much يا أخي.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد بلاد ميلاد. بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد بلاد ممتد لحد حدود الحد، وطن لا فيه